If you've ever had a concern about a foot infection, either you've battled one or you've worried about having a foot infection and you are diabetic, then you're going to want to listen up to this video, because today I am talking about 5 common reasons why diabetics get foot infections. So stay tuned. Often I focus on type 2 diabetes, but in this case it is relevant to type 1 diabetics as well. So before I get on with those 5 reasons, let me introduce myself. I'm Dr. Amina Goodwin, a physician and a health coach, and I help you learn to eat better so that you can feel better and get on with life without having to be bogged down with the healthcare system. All right, so we're going to dive into it. Diabetic foot infections. That's one of the biggest struggles of a diabetic, and also one of the biggest fears of a diabetic as well, because everybody, when you hear diabetes, you hear amputations of the toe, of the feet, of the toes of the feet, and so on and so forth. So it's an ongoing concern for a lot of diabetics, right? And rightfully so. With amputations, of course, prior to amputations, there is the pain and suffering, and then ultimately the expense of the healthcare associated with amputations, the surgery, and then the disability after, and the loss of income, earning potential that would follow that. Okay, so we're going to dive into these 5 reasons. The thing about it is that if you understand how a foot infection can arise, then you can take action to prevent or to greatly decrease the chance of getting a diabetic foot infection. Okay, so let's get into the 5 common reasons for foot infection. The first one is the higher chance of athlete's foot in diabetic people. So athlete's foot, that's essentially a fungal infection between the toes. And because between the toes, especially if you are wearing closed up shoes, it tends to be a moist, warm area. And fungus, it's normal to have some amount of fungus on our skin, but if the environment is right, you have overgrowth of the fungal organisms. And in this case, the environment would be, like I said, the moisture, the warmth, and then also the diabetic condition. Because with diabetes, the body in general is sweet, and fungi, yeast organisms, they love sugar. Sugar is food for these germs, and so that just helps everything. It's just a good, perfect environment for those germs to thrive. Now, the thing about fungal infections of the feet or athlete's foot, it can be mild, but what happens is that it could tend to progress to the point where you have sort of cracking of the skin, and we talk about maceration, but essentially it just gets very moist and weepy, and then you have cracking between the digits, and it's those cracks which are entry points to bacteria. So those are the serious infections now, where the bacteria gets introduced into the skin and into the deeper tissues, and ultimately those bacteria can travel to the bones. And that is when things really get bad for a diabetic, because bone infections are very challenging to get rid of. The bone is a dense tissue, and so you don't just give antibiotics for a week or 2 weeks for a bone infection. You literally have to treat the antibiotics long enough to penetrate all that dense bone so that you can kill every last bacterial organism in there. If you treat the infection for too short, then you have still remnants, few bacterial particles. All you need is one living bacterial particle for there to be multiplication after you discontinue the antibiotic, and then the infection can recur again. And so some people would have this lingering, persistent, chronic infection, that they just can't get rid of. And what it is that the infection is in the bone, and they're partially treating this infection for short amounts of time for over a period of years, but never getting directly to the root of it and to eradicate it. Another thing with bone infections, why they're so hard to get rid of as well, is that sometimes you actually have to clean out the bone. So it involves a bit of surgery to get rid of that dead bone that might be right there harboring the germ. And the thing about the dead bone and dead tissue in general is that you cannot get penetration of your antibiotics that you're taking so faithfully into this dead tissue, because the dead tissue has no blood supply. And so you're just treating this condition in vain. So anyway, ultimately it starts with athlete's foot, with these cracks in the skin from this chronically moist, weeping skin. Okay, so that's one. Second big reason for diabetics getting a foot infection is swelling. So swelling, we say edema, but just chronic swelling of the skin, of the leg, that's a common condition. A lot of times diabetes comes with other conditions, including kidney failure, or not necessarily complete to the point of being on dialysis, but some degrees of kidney failure. There might be liver issues, there might be a bit of malnutrition, so multiple reasons for there to be swelling. But sometimes it's just because of malfunctioning valves in the veins of the legs, and so you have this chronic swelling. Now the danger with chronic swelling everything is fine as long as your skin is intact. But a lot of times with swelling, especially when it's severe, a simple scratch, as in you might go outside and you get a simple scratch with a thorn, and because of that now opening in the skin, you have oozing of that fluid that's accumulated in the tissues, right? The fluid that is there causing the swelling. Now it has a space and that fluid can leak out. And because of the fluid is under pressure, because the legs are swollen, so there's that pressure, so it's always going to push through a potential space or a place of lower pressure, and you have this never-ending wound which just gets worse steadily unless you control the swelling, unless you really compress the area so that there's less pressure for long enough for this scratch to heal. If you do not control that swelling and the oozing just persists and persists, what happens is that you can get infection, because that fluid, it has nutrients, it has things that the bacteria would like, nutrients that it would feed on, protein and so on, and it's just a good setup for infection to come up. And we see people who have these wounds for months, sometimes years, because for whatever reason, it's just a challenge to get rid of the swelling. So swelling is one thing. For swelling, I mean, elevation, that's one of the common pieces of advice. Now, some people, they have to work, and so they just cannot elevate their legs. And so the second best thing would be compression stockings. Now, if you're living in any hot area, like there's a heat wave going all across the south, especially the Caribbean Islands are suffering from heat, and just there's a lot of heat around. So obviously it's extremely challenging to really stick with compression stockings when you're plagued with this heat. Other than stockings, there's this thing called a Una boot, which is like a Velcro thing that really works very well. A lot of times people have difficulty pulling up these stockings because they're so tight. So they're these special boots that you can buy or order. Might not be that cheap, but it's so effective and also more long lasting than stockings, which sometimes can tear, right? But anyway, swelling, a big problem because of for the reasons I explained, right? Third reason is inability to feel pain, so nerve damage. We call that neuropathy. Diabetes is a condition that damages the tiny vessels, right, all over the body, including those tiny vessels that supply the nerves. And if those nerves have no blood supply, then the nerves get damaged, they die, and you have no feeling if you have no nerves. And if you don't have any feeling, then it means that you can step on any little thing or get any little bump or bruise, but you have no feeling, so you don't feel the pain of inflammation. And this thing can go on and on and on until the next thing you know, you have a bad infection, lingering bone infection or something serious like that, right? So for this, you just have to inspect your feet every day. You have no choice if you have no feeling. Well, first thing, you need to assess if you have any compromise to your feeling. You can go to the doctor. They can do a simple test. We call it a microfilament test. And there's some other tests as well that they can check to see if your sensation is damaged. Regardless of if your sensation is damaged or how severe, you need to be getting in the habit of inspecting your feet every single day as a diabetic, just in case there's something that you might not feel, okay? Another neat trick as well actually is for a diabetic to get in the habit, well, then you have to balance this with the whole athlete's foot thing. But if you can wear white socks without maybe sweating too much, then any little thing, any wound will drain onto the white socks and you'll see the blood or the fluid or whatever discoloration, and that can be a hint that you're having a problem with the foot. What I should have mentioned with the fungal infection is actually keeping between the toes dry, and you can use powder, either regular powder, cornstarch, or actually an antifungal sort of powder, okay? All right, so moving on now, I am going to go to the fourth reason why a diabetic might be at increased risk of having a foot infection, and that is poor circulation. So I spoke about the swelling, which has to do with the veins and the valves not working well in the veins, and so you have all that swelling. But separate from that, you can have poor circulation involving the arteries. So we spoke about the tiny arteries that supply the nerves that can be damaged. The bigger arteries can be damaged as well. So it starts with the tiny ones, and gradually the bigger arteries get affected, and then eventually you're having blockages of these arteries to the point where the tissues, the skin and the tissues are just not getting enough food, not getting enough oxygen, not getting enough nutrients, and so these tissues can die. And if you have tissues that really are not getting the nutrients and or on the verge of dying, and little germ can brew there because it's not being flushed out by all the good things in that make up the healthy immune system, and so all the good healthy immune cells that gobble up infection, right? So poor circulation is another reason for diabetic infections. Now, the thing about poor circulation, once it comes up, it's kind of hard to reverse. A lot of times you just want to keep it steady. You don't want it to progress, so you have to do things to really control your diabetes so that the circulation doesn't progress. Other habits like smoking and so on that could contribute to poor circulation. You need to really get behind those. But then in some places you might have good access to surgery, and so they bypass procedures. The surgeons can sort of attach new vessels to increase the circulation. So if you're in an area where you can get that done, then that might be the solution. But at the same time, you want to make sure you kind of look at your diabetes, because you don't want those new blood vessels to get blocked as well soon after. Okay. And then the fifth reason why people with diabetes might be at high risk of infections is high blood sugar, obviously. So having persistently uncontrolled diabetes makes all those 4 things that I mentioned much, much worse. Like I said, germs love sugar. Sugar is food for germs, and it's just the perfect setup, right? So you must control your diabetes first and foremost if you really want to reduce your chance of having a diabetic foot infection, right? So these are the 5 reasons, right? And I gave you the explanations. You can go back and listen to the explanations again, but just to summarize, 5 reasons, key reasons or main reasons why diabetics may be very prone to foot infections is 1, the higher chance of athlete's foot. 2, swelling, the high prevalence of swelling of the legs, right? 3, not feeling pain because of damage to the nerves from long-standing diabetes. 4, having problems with healing because of poor circulation, not getting enough oxygen to the tissues. And then the fifth and final one is just having high blood sugar, uncontrolled diabetes, right? I hope you all found these helpful. You have to be proactive with anything, all these conditions. You just kind of have to be proactive. You can't just relax and expect that things will be okay. We have to actively prevent the things that we don't want to happen. And hopefully you all found these tips really, really helpful. And if you did, go ahead and like this video. And if it's not you that's diabetic, well, share this video with somebody who you know will benefit from this information. Thank you for watching, and I wish you, as usual, continued good health.